Terminal weaning is the removal of ventilatory support from a patient with the end result eventually being death. This is done when a terminally ill patient has reached the end of life with no possible recovery and the decision has been made to remove life support. This decision is usually made by the patient's family or the agent that the patient has appointed on the advance directive. There are two methods of terminal weaning on a patient. One is terminal weaning with the ET tube being left in place with only removing the assisted ventilation. And the second is terminal extubation, where the ET tube is removed at the same time as the assisted ventilation. Now, since the RT's job is to protect life, sometimes terminal weaning or extubation can be difficult, and it can cause some ethical dilemmas for the RT. Sometimes it's hard for RTs to accept that a patient would choose to rather die and choose death over living off of assisted ventilation. This is especially difficult for long-term care patients that the RT has formed an attachment with, or a conscious patient that you go from talking and interacting with the patient to removing life support and knowing the end result. These situations, it's good for the hospital to have a support system set in place. Having a debriefing after removing ventilatory support with fellow RTs or the clinical team that was caring for that patient, that may help with the coping by being able to express their feelings and have those communicated. It would also be a good idea to avoid having the same RT do back-to-back terminal weanings or extubations.